Welcome to your code card introduction. Code cards have all the necessary equipment needed for patients undergoing medical emergencies. You'll notice that each drawer is labeled according to the stuff that they have in them. In our first drawer here, we have emergency drugs. So we have medications such as epinephrine, lidocaine, atropine, calcium, bicarb, etc. When preparing these medications, opening the lid and popping off the yellow caps, you would then screw both components together, hold the green piece, and spin the yellow cap counterclockwise. If this green section does come off, it is okay. Simply place the green lock here back on, and you will be protected from the needle with this divot here and protrusions on each side. After screwing in the medication and having this complete unit, you would administer the medication to the patient as needed. Okay. After the emergency drug, see you have the IV start equipment if needed, IV fluids, tubing, and flushes, suction and suture equipment, airway equipment if the patient requires an artificial airway, and oxygen delivery devices. These include your ambu bags. When providing ventilation and breaths to patients using an ambu bag, it's important to give yourself enough space, so remove the headboard if you need to. Depending on if it's a child or an adult, selecting the correct ambu bag is very important to providing a proper seal. In this scenario, we're going to choose the small ambu bag, and I will place the mask around the nose and mouth and pressing down with my pointer and thumb, and then using the rest of my fingers here to provide a chin lift. When administering breath to a patient, it's important to not fully compress and be too aggressive, as you want to imitate the appropriate inhalation and exhalation that a patient would experience. If your patient is experiencing a shockable rhythm such as VFib or pulseless VTAC, you have your AED on the side of the code card to assist with them. The first thing that you do when bringing your AED to the bedside is opening it and turning it on. Following the prompts would ensure that you're doing everything properly. First, peel up the shirt, exposing the skin, and for this pediatric patient, one pad would be placed on the upper chest and the other on the upper back, after peeling the shirt as well. For an adult patient, one pad would be placed on the upper right chest and the other on the left lower rib. On these practice pads, you see that there's a cross indicating where the pad should be placed. The AED will speak to you and provide a beat for your compressions, and will also stop when it's time to provide breaths.